All right, party people, we are back at it with another one. Let's get it. So we're going to ease into this one with some light anatomy, starting off with the osteology of the hand, specifically the carpal bones. So to remember these, I use the mnemonic, some lovers try positions that they can't handle. Some stands for scaphoid, lovers stands for lunate, tri is for triquetrum, positions is for pisoform, that is for trapezium, they is for trapezoid, cant is for capitate, and handle is for hamate. All right, now let's get into something that might be clinically relevant on your licensing exams. So if they give you a chick that was drunk, twerking on a cop car, and then she fell down on an outstretched hand, she now has pain over her central palm without pain over the anatomical snuff box. Which bone did she fracture? So you need to know straight up that the pain over the central palm without pain over the anatomical snuff box is consistent with a lunate fracture. So when we talk about fouche being fall on an outstretched hand, it's almost always associated with pain over the anatomical snuff box, which is located at the base of the thumb, the dorsal radial aspect. If there is pain in this area after a fall, it's a scaphoid fracture. So you have to know that for scaphoid fracture, the classic presentation is pain in the anatomical snuff box after fouche. The initial x-rays are often negative. Despite the x-ray, you must immobilize the thumb with a spica cast. You re-x-ray in 2 to 3 weeks. If you don't immobilize properly, there's a high risk of avascular necrosis of the scaphoid. This is very high yield. As far as lunate fractures, this occurs with fouche as well. So the key distinction is, with lunate fractures, there is no pain in the anatomical snuff box. Instead, the pain is at the central base of the palm. You have to be able to distinguish these two. This isn't hard, you just have to remember it. Now, in terms of the hook of the hamate fracture, typically this is caused by handlebar impact, so think of bikers. This is located at the medial, aka the ulnar side of the wrist. This can lead to Guyon canal syndrome, which is the entrapment of the ulnar nerve at the wrist. This presents with hypothenar, paresthesias, and numbness. So just to wrap it up, scaphoid fractures, snuff box pain, fouche, thumb spica cast, avascular necrosis risk. Lunate fracture, central palm pain, fouche, no snuff box pain. Hook of hamate fracture, handlebar injury, ulnar nerve symptoms, think Guyon canal. All right, that's it for this one. Go crush it.